We have Dr. Nia Imani Bailey. She's a West Philadelphia native, radiation therapist, and advocate dedicated to advancing equitable, compassionate care for underserved communities. Appointed by Governor Josh Shapiro, she uses her voice and lived experience to drive change in healthcare, policy, and community empowerment. Y'all already know what to do. Let's give a warm We Talk Weekly welcome to Dr. Nia Imani Bailey.
Jeez, all these smart folks, man. All the women in STEM and
I love
these doctors. And, geez, I feel a little undereducated right now, you know? But I like to welcome you to the show. How, we always start with, how was your day? How you feeling today?
I'm good. I'm here. God woke me up this morning. I'm good.
I know that's right.
And she just has an aura, too. I can feel the energy.
No doubt. Why don't you fix her mic real quick?
Like
her
this?
out. Yeah,
Okay.
there she go. There you go. So I want to jump right into it because just like our last guest, we always start with kind of like the education piece and what got you. And let's start there, because we can build on your wealth of knowledge because you're like a walking brain right now, right? And so, come on, doc. It's one of those things. So let's talk there. We start for your undergrad and let's work our way up. Yeah, for sure.
My family always called me doc. I wanted to be an obstetrician because of the Cosby Show. I was like, I want to do that. You know what I mean? Yeah, but then I volunteered in labor and delivery, and I'm like, there's no way in God's earth you would ever doing
but
that.
How about the Cosby Show was motivation?
Of course, you kidding me?
Wow.
Claire and all that. And then my family was like, you're going to be a civil rights lawyer. You're always for the people. And I volunteered. I said, no way. There's no way. But it wasn't until my father had prostate cancer, I got into the same field that helped cured him. So when I volunteered in radiation oncology, I was like, this is exactly what I want to do. And I've been doing it right out of school for 11 years.
Wow. Yeah. You're going to have to let the men know how prostate exams are needed, scores, the whole
thing is
PSA,
important, and even knowing your breast. Like my mom's uncle Bobby passed away of breast cancer, and a lot of men don't understand that they can get breast cancer. So, pour into yourself. As Black people, we always work, but if you're not healthy, you can't work. So you got to make sure you get the screenings, you take care of yourself, you get exercise, you eat nutritiously, all those things. So if you pour into yourself, you can do all the great things in your life.
Absolutely. Yeah. Absolutely. And what you said about the about checking your body, a lot of times I saw a study that said that we're living longer, but we're not thriving. And that's the problem. We have all this innovative therapy. We talked about AI, laparoscopic, robotic type of stuff. Right. But if we're living past the line of let's just say 70, do we have quality of life? What are we doing to help that? But we could talk about that later. Tell us about how you got into the field that you're in.
My father, he had prostate cancer. A lot of people in my family have cancer, from pancreatic to liver to multiple myeloma to lung. You name it, we had it. So I needed to make sure I got into the same field that could potentially help my family. And I wanted to learn about risk reduction. I wanted to learn about the different treatments, survivorship, and everything in between. So I felt like if I got into this field, I would be able to help all people, but specifically my people.
So you advocate for your family, basically, with the conversation with the health, with what the health is going on now. When I worked in oncology for 30 years and radiation oncology. And I actually stopped working in that field based on the death rate that I kept seeing. And I'm looking at it to say, is it just the US? Is it other places that, we say we're a value-based care type of model, but is it really about the financial gain that they're getting? Tell us about how people can be able to advocate for themselves when they're dealing with the health system in order for them to have a better clinical outcome.
Absolutely. We were born with a voice, and you need to know you have power in your voice. So you know your body better than anybody. So if you feel like there's been a change in your normal, and if your provider is not listening to you, you can fire your provider. I think I always tell people there would be no doctor if there was no patient. So you have that power. If you say, hey, there's something going on with me, and the provider's not listening, go to another provider. Tell them, hey, my breast is hurting. I've been having headaches. My stool has changed, which can be indicative of colon cancer, So first you have to know you're normal, and then you just use your voice and say, hey, there's something going on. You need to listen to me. And if you don't feel like you have that voice, get an advocate yourself, your family member, your neighbor, your church member, whomever, because I can understand when you don't feel well, you don't have the energy to advocate for yourself. Right. You can call me, you can call whomever, and we will do that advocating for you, because so that you can get to a life that you are thriving and not just surviving.
I see our Esquire shaking her head back there saying yes to all of what you're saying. Tanisha, let us know from even a legal perspective, when you're in the health system and you feel like there's a neglect. Does a patient, or let's just say a person, have anything to stand on legally, Tanisha?
So I think that when people are patients, and like she was saying, you're not feeling your best, your mind isn't going there. Like, what are my rights? It's I need help now. I need to feel better, even if it's just momentarily. And then long term, I want a diagnosis and how I can get through this. And you're trusting that the doctors are there and the nurses are there to do exactly what you're asking them to do, make you feel better, get you to the other side. You're trusting that they're listening to you. But unfortunately, oftentimes we see that people are not. Things are going in one ear and out the other. Even for me, I have to warn my doctors, even the ones I see regularly, I am not your textbook patient. I fall in that 1%, the stuff that you never see, the stuff that you gloss past in school. I'm abnormal on every chart and every scale. So if I tell you something, I mean what I say, and you need to apply whatever the differences are to me. But I'm an attorney. I'm going to fight. And if I, like I said, if I don't have the strength, I'm going to call somebody like her, because I know she'll get the job done. But you get into that legal fight kind of at the end sometimes, when you've already lost so much of the battle, when you've already spent so much money, when you've already gone through so many doctors. And then sometimes people are depleted and don't even want to do that. My family, when they go to the emergency room, they got me on speakerphone. When I go to the emergency room, my nurse friends will show up, because even though I'm an attorney and I can advocate for myself, there are things that I just don't know. And so, from like Dr. Nia was saying, it takes a community approach to get the job done. So like she said, if you're feeling like you can't, you can call this one. I was nodding my head extra fast because this one is going to get out there and get something done. I have seen her in action. She is definitely an advocate. She ain't got to know you, and she never going to ask you for a dime, because that's what matters. People matter. So people are out here, y'all.
She outside. Catch her outside. Catch her outside. Right? Listen, this is new for me, right? You got like 10 letters behind your name,
Father,
right?
help us.
Let's talk about, because I've never seen half of this stuff. All right, so DPA M.A.E.D.R.T.T. Let's talk a little bit about that. That's new for me. Jeez. That's why I said she's a walking brain, ladies and gentlemen.
Oh my gosh. Doctorate in public administration, master's in education with a concentration in bilingual bicultural studies, and radiation therapist, technologist.
I love it.
But my best title is child of God. Like, none of that really matters.
I know that.
None of that really matters.
Fantastic, man. So, where can I oh man. So we talked a little bit about your education. We talked about your work. You know, when you look at where you are today, right, and all the things that you have accomplished, is it something that you say to yourself, Dad, if I would have known then what I know, if I would have known now what I knew then, right? What would you have changed?
That's a great question. I don't actually feel like I've accomplished a lot, because there's still people dying of cancer. So I don't feel like that. But I wish that I would have known that eating healthy and moving your body is good. I wish I would have known that, Nia, don't smoke the hookah in college. Don't binge drink. Mocktails are just as cool as alcohol. Why do we feel like when we have to celebrate or when we're depressed to drink? There's other things to cope, healthy things, that you can cope with. I wish I would have known my family cancer history earlier. There's a lot of things that I wish, but I don't feel like I've sort of reached the pinnacle, because there's still people who don't have the education. There's still people who are dying. My girlfriend was diagnosed with metastatic breast cancer at the age of 26 years old and passed when she was 30. I haven't done anything if that's still happening.
I don't know why that just sat on me.
Yeah.
So sad. Oh, goodness.
That shut me up real quick.
You also made me think about now what's going on with our younger generation, the Gen Z, and this vaping stuff. And I had the conversation with you know, I won't name any family members' names, but some people in my family, and we were just talking about like how, you know, back in the day when cigarettes were popular and how you only saw, I was explaining how like the ads and the marketing and how they kind of marketed towards kids and preteens and all that. And then I was just like, well, yeah, I guess it would be cool to see like an older person smoking a cigarette for like a teen to look at that. So they're doing the same thing. Like, you know, when my dad was younger and like he saw cigarette commercials, which they don't even have that now.
Right.
But you know, when he saw that and he saw that when he was younger, now they see the vaping and they don't have the commercials, but they see the friends doing it and all that, and they think it's cool, and it's so harmful to their bodies. And it's just like you're starting to see these cases pop up where it's like, you know, somebody it's talking about like the vaping and how addictive it is, and then how like it starts off with you vaping just a little bit, and then you need more and more to achieve the same, I guess, high effects or whatever it is. Like, how do we reach this generation, especially when it's just like it's just so popular to do?
Right. We teach them habits now, because I think when children vape, they think it's cool. They may be stressed, but okay, let me show you. When I'm in a good mood, this is what I'm doing. I'm not doing something that's destructive to my body. I'm dancing, I'm moving, I'm doing whatever, you know, something that's healthy. Okay. When I'm stressed, I'm not going to the bottle. I'm not, vaping, I'm praying, I'm meditating, I'm walking in nature, I'm doing those things. And I think once that's seen and mimicked, then children, you know, they're followers. They want to do things that look cool and popular. So when they see that, then they do that, and then that trajectory then changes. I also think a lot of things are purposeful that come to target our community. You know, in the inner city, how many fried chicken places are there? How many tobacco places? And, you know, especially now, like a lot of vaping shops and all of that, that's purposeful. But let's put some ecotherapy in our community. Let's put some more churches and mosques in our community. Let's, you know, do all of the things so that they understand that these are the things that you don't want to go to. You want to go to here. You got to change that narrative.
Wow. You mentioned, you talked a little bit about cancer and some of the elements and viruses that's out there. What's your take on, and I'm sure Lauren can probably find the exact name, but it was like the National or the International Health Foundation or something like that has, since the U.S. has disconnected from that, we have different countries finding cures to stuff. You know, what's your take on that? You know, do you feel like, you know, there's this kind of gatekeeper idea to stop, you know, cures because we want to look at big pharma or something like that? What's your thoughts? Yeah.
You trying to give me cancer? No, I'm playing. I'm honest from West Philly. I don't care. Of course. I mean, I definitely think, I don't know for sure if there's ever a cure for something. I'm not trying to be pessimistic, but I do think it's a very lucrative business to keep people sick, for sure. So that's why we're not teaching, you know, have more vegetables, don't eat a lot of pork, don't do all of this. I think that's definitely purposeful, for sure. I can't say that there's a cure for anything, although that's always the goal. You know, hospitals, big pharma, they make great money. And so, you know, as long as you're sick, we're always going to keep getting paid.
And you're so right, because if people understand, umpteen years ago, like let's just say the early 1940s, it was pushed to eat healthy. It was pushed to not have every FD&C, yellow number 40, this and that in our foods, right? Yeah. And then it got to a point where the meat market was going down and they pushed breakfast. And they don't realize that breakfast was only pushed because of the money. They wanted us to spend more money. Exactly. So with free radicals, all of these different things that are going on, Big Pharma makes more money. So with that being said, in regards to having different type of autoimmunes, like, and I don't know if you want to disclose that, but what's your outlook now, seeing it from the patient's eyes, being on the doctor, on the medical side, as well as on the patient side for you?
I mean, I was diagnosed with lupus maybe 2022, but I probably had it since I was 17 years old.
Oh, wow.
You know, and my take on it is that we are eradicated with so much stress, with so much disease, with so much illness in ourselves. And it is, from the patient perspective, I was very frustrated because I'm like, you guys knew I had this. All you had to do was run an ANA. All you had to do was check my C3, C4. That's all you had to do. And we could have did some investigating instead of just giving me a blanket. You have angioedema, meaning that my joints just flared up. So that's where my perspective is even more so the advocacy component. Like, I know my body. Wow. I'm telling you, there's something wrong. We need to do some research. And if you don't know, let me ask ChatGPT or something so I can figure it out. And then we can have that conversation. And it gave me even that voice. Like, doctors, they practice medicine. So they don't know it all. They're practicing. So let me help you in this pursuit of trying to figure out what's going on with my body. And let's even say this, we don't even enroll in clinical trials and all of that. So there's a lot that they don't know about Black bodies.
Wow.
So they are actually practicing, and I don't mean practicing like guinea pigs, but they don't know.
They already did that.
Yes, they did a long time ago. But some of our DNA, they just don't understand because we don't enroll, we don't give our DNA, our tissue to be researched. So the things that happen in our bodies, they're very perplexed. They don't know either.
Right. Do you think it's a U.S. thing? Because so many places, I actually went across country. I went to Turkey for medical care. Medical tourism is highly approached in other countries versus the U.S. And they are giving a different type of, here you are, here's what you have, and it's 75% from the percentage of what the U.S. is charging. Right. So why is that? Why is it that the U.S., the place where everybody wants to come, so to speak, you got people like, I don't want to go over there now, but you know what I'm saying? Like, why is it that the U.S. versus other countries are putting poison in our foods? Other countries are not allowed to have certain things and ingredients in their food. Why is it happening here?
Greed. You don't wrestle against flesh and blood, but spirits and principalities. That's all I can say.
When you talk about the gene thing and our genes, the one thing, and I believe you did the story of Henrietta Lacks. I think of, the superpower that she had, right? When we think of like research, right? Should people who look like us have a legitimate fear because we have always been experimenting on, right? Wow. And I use that as context, right? When you had people pushing for like, when COVID, the vaccines, and everyone's like, I don't want to get vaccinated because literally I don't know what you're putting in this. Do you believe that we have legitimate concerns and we should, worry about what's being put in our bodies? So
Sure. I understand why we are fearful because there's always going to be a medical apartheid. Yeah. That makes sense to me. Wild. But I do think that we should do it scared. Because I think if we don't enroll in clinical trials, then we're always going to be dying. They don't know what's working on our bodies. Like, for example, you ever been in a public bathroom and you wave your hand to get the water to come out the faucet? That wasn't tested on darker skin.
That's why it don't work for me.
Oh, wow.
So sometimes you're trying to figure it out. So something that simplistic.
I didn't know that you have to keep waving.
It wasn't tested on our skin. That's so crazy. I say that to say things in life aren't tested for us, aren't known for us. So we're always going to be left behind. And let me say this, they're always going to create medicine. They'll just do it without us if we don't enroll in clinical trials. So I'll always raise my hand to be in clinical trial because they might not find it in my generation, but I'm going to be darn sure my nieces don't have to face what I face. You think about the HIV and AIDS epidemic. My Uncle Kyle passed in 1985 of it, but then they got so much DNA, whether you're Asian, whether you're Puerto Rican, African American, whatever. So now if you get diagnosed with it, although you may not want the disease, you can live and thrive. That's not the case with cancer. So that's not the case with diabetes, all those things. So we have to do it scared. I'm not saying don't be scared, but you have to do it scared.
Yeah.
And
that's crazy.
As a person who's in radiation oncology and just someone who may be watching this, can you let women and men know specifically as to what they can ask for when they're talking to their doctor? Let's just say they've been diagnosed. And you can highlight this more. BRCA1, BRCA1 to see if it's in your family,
Mhm.
your PSA, your Gleason score. Tell us more of something more towards the breast and prostate, since it's up in the top 5 as far
Sure.
as with cancer.
Absolutely. So first I'll take it. Do you know your family cancer history?
Mm-hmm.
Do that.
Mm.
Then go to your provider, establish a patient-provider relationship and say, hey, I know my father has prostate cancer. I know all my uncles have prostate cancer. And I know by that increases my risk of breast cancer. So I took that to my doctor and he said, okay, you need to go see a breast surgeon. The breast surgeon said, okay, tell me your family cancer history. Again, I said it. She put my information to what's called a risk assessment or risk calculator. And that determined I have a 20% risk or greater of breast cancer. So from there, I at the age of 28, I get 2 screenings. I'm now 33. I get a 3D mammogram and a breast MRI. From there, I did genetic testing, and we know about BRCA1 and BRCA2 for breast cancer, but I have a gene BCL6, which increases my risk for lymphoma. And those are the things that we don't hear about. So now I get regular blood tests and all of those things. So you want to first go back to your family. Do you know your family cancer history? If you do not, that's fine. If you're adopted or your family is just so secretive they won't tell you, still tell your doctor, because they'll treat you as if you're high risk because you do not know. And then it's important to know your breasts, men too. So usually women do it at the top of the month, April 1st, at the top of the month, and you want to feel your breast in the shower. You want to look at it in the mirror. You want to do it while you're laying down, and you want to do it soft. You want to press hard. You want to go up and down. You want to go all around, and to feel something. You want to do that every month, because if you then feel that something has changed, you can then have that conversation with your doctor. And to the women who are on their menstrual cycle, know what your breasts feel like before your menstrual cycle, during, and after, because there are some changes that happen.
And the look.
Yes, and you want to make sure there's Know Your Lemons has a it's an organization where there's like 12 signs of breast cancer, whether your nipple is inverted, whether there's a discharge coming out your nipple, whether your areola looks like an orange peel, whether there's a growing vein, whether there's a lump. I've even had a friend of mine where she didn't have pain in her breast, she had it in her arm because the tumor was on her lymph node in her arm. So anything that's outside of your normal, know that. For men, for prostate cancer, if you are experiencing like your stream isn't correct, you got to pee, stop, things like that. For colon, your stool is different, whether it's really watery, it's red. For pancreatic, your stomach is hurting, you've lost a lot of unintentional weight. And I just blatantly say anything out of your normal, ask the doctor, say, hey, something's going on. Can you run a blood test? Breast, I need a breast MRI or 3D mammogram. And if they tell the women or men you have dense breasts, that just means you need another screening, because they can't determine if you have cancer or not.
Black women have
the image looks very white. So whenever they tell that to me, it's like, okay, I need either an ultrasound or breast MRI. So you can definitively tell me whether I have something or not. So you just have to I think it's easier to have an advocate with you so they can know all the things to ask. But the point is, whenever you know something out of your normal and that has changed, have that conversation with your doctor and establish that patient-provider relationship. Because I have a young Black doctor, and she probably knows my body better than I do. So if I tell her there's something wrong, she's not going to hesitate, and she's going to send me to the appropriate screening or test to make sure that everything's okay with my body.
I just hope somebody heard
one second. Yeah, 1 second, because she kind of blew my mind right now. I need a break for a minute. That wore me out. I'm just, jeez. 1 second.
He got the stretching guy on here.
Jeez.
Oh my goodness. That was a lot. A good
that
thing.
Was amazing.
That was phenomenal.
Yeah, because I'm
that
sure
that was so beautiful.
It was because and I'm sure that's going to help a lot of people who's actually watching. And
yes.
You talked a couple things. You talked about an advocate, right? And so for those who watching, how do a young lady get an advocate? Because I also heard that there's still this idea, especially when it comes to we generally have a fear of doctors, right? Anybody within the health field, right? Because one, we feel like a statistic, right? Or we feel like you don't take it seriously, right? And so there is this, elephant in the room, this cloud over specifically women who feel like when we're in pain or when they're in pain, doctors don't take them seriously, right? And so how could someone have an advocate or advocate if they don't have an advocate? advocate to truly be taken seriously if they go in?
You just say, if you feel like you're not being heard, you need to listen to me. Sit down. I know you got 15 minutes, but sit down. I have 12 questions to ask you. And I need you, I'm still not feeling better. So I need you to figure out, I need you to research, be a detective, and figure out what's going on with me. And I know a lot of our people say, well, I felt okay, but then I went to the doctor and then I came out with this disease. That doesn't mean that the hospital gave you disease. It means that it was masked in your body, right? And then they found the test to figure out what was wrong with you, and then now you have it. So I want to, and I say this to the Black men too, because you got to take care of the family, you got to do all of this. Y'all better pour into yourselves too.
Yeah,
that's right.
That's why with prostate cancer being on the rise and all these things, if y'all don't pour into yourself, you aren't going to be here.
That's right.
So it's really important.
A lot
to
of
just
them
pour
having
into
heart
yourself.
attacks too.
You kidding me?
Young men.
Better pay attention to your body and stop playing.
So in relationships, if we feel that stress, then what we do? Okay, I mean, you said pay attention to our bodies.
Listen, I'm from West Philly. Try me.
Doctor, I have a question for you. And this is going to be one of the good news, bad news stories. It's about, and you were appointed by Governor Josh Shapiro. So I want that to be known. Philadelphia, a federal judge just stopped for the vaccinations. I think it was 17 that they were trying to push, but it's now, I think, going to be 11. Tell us more about what your insight or input is on vaccinations. A lot of, and this isn't statistics being proven, but a lot of parents feel like the vaccinations are causing the high percentage of autism in children. So what's your thoughts on that?
I think vaccinations are a good thing. I think they created vaccinations because back in the day there was bubonic plague and all this other stuff. So vaccinations are here to help help humanity. I think even with cervical cancer and the
HPV.
Absolutely. So I think that's important. That reduces the risk of getting cervical cancer. And I understand as a parent there, you may be fearful of giving your child something, but I think get somebody vaccinated. I mean,
so at that young age, do you think that it should be a time frame that they wait? Because I mean, I'm a person who believes in epigenetics. Epigenetics meaning that we are not the same people that we were 50 years ago.
Correct.
And because of that, they're saying, oh, well, stabilized vaccines have worked all this time. Well, these are not the same people.
Correct.
These, young men are not having their Adam's apple like they did back in. They don't. They don't have the chiseled jaw. It's things that have changed over time. And it's like, do we need to look at the vaccinations? Does a newborn baby need 4 or 5 shots at the same time? Right after birth.
Good point.
You know what I'm saying?
No, I do. I think that should be a piloted study. I don't know. I agree with you. I think, like you said, things change, people change, and I think that should be a piloted study. Let's give that baby the 4 shots and see how the baby goes on in life and progresses. But let's not give that baby 4 shots and see how that baby progresses.
Wait till that baby turns 5.
Exactly.
And then we'll go ahead.
And I think that needs to be piloted. And I think it's a fair pilot too. I don't think I'm not saying, give everybody 13 shots every 5 days, but I think it's fair to your point that
I'm an advocate for vaccination.
Absolutely. No, but I think to your point, it's very fair. There should be an age, but I think it also should be that conversation between the patient, the provider, and their parent. Absolutely.
And speaking of the HPV, I remember that I have 4 children, 3 girls, and for all 4, I was going to get HPV and they were like 9 or 10. But then I waited, and when they got 15, there was more strains that it covered. Then when they got 18, it was like 30 more strains. So I was like, well, if I would have got it back then it probably wouldn't even have worked. And I'm putting this in them. So I didn't do it and let them be the ones for themselves to see if they wanted to get it.
They had more time to do research. Like I was the guinea pig because I'm 33, so I was thinking 9 when I got it, 8 or 9. And my mom was like, "My child, I'm not doing." My father was like, "She's getting it," and somehow he wanted to argue. Maybe that's why they got a divorce, but I don't know. But to your point, I had to get other shots because I needed to get more things to cover the other strands that are out there.
So, geez, this is a lot. So
in a good way.
In a good way. So, Brother Rashid was like great information, and I want to give this young lady an opportunity because you spoke about your doctor, and I believe this is what that is. For those who's looking for a great doctor, this young lady said, this is Coastal Tiff said, can she share her doctor's name if you're comfortable with that? And if not, how can people find good doctors? Because that has always been a problem also. Thankfully, I found a good one just kind of like by luck, right? Young doctor looks like me, and understands me. But how can someone find a great doctor? Yeah.
Absolutely. So Dr. Kimberly Rogers, I think she's on Instagram as Restore MD Med. Just don't take my appointment, but Dr. Kimberly Rogers, she's amazing. And you can go on Black Doctor, I think it's .org. You can just even Google whatever type of physician that you want, Google that, and that will come up. But you can also, I'm not saying do this all the time, but you can fire your doctor. You can have you have an appointment and you're like, this doctor just, we're not really meshing well. Yeah. Let me find another one. But my doctor, who I absolutely love, Dr. Kimberly Rogers, she's amazing. She takes time. We have each appointment is 45 minutes to an hour if I need it.
Jeez.
Wow.
Yeah.
What kind of doctor is she?
Primary care.
And she's a PCP.
Yep.
Wow. What's your thoughts on herbal medicine?
I think it's important. I think, and this is my thing, I think Western medicine and herbal medicine and integrative therapy can be a marriage.
That's what I say.
Just marry it. Yes. If you first have a headache, do I think you should take the Tylenol first? No, maybe drink some more water, maybe do all the things, maybe drink some ginger ale.
Yeah. They don't make ginger ale like they used to.
They don't. But then if you need it, take the Tylenol. I think it should be an absolute marriage.
And I'm going to throw something in there because I love holistic medicine, but I am about Western medicine. You can do the tuning forks. Tuning forks back in the 40s was before the pills for migraine headaches. So you take the mallet, you hit it, and then you put it on your pituitary gland. You could put it on your collarbone, and it's supposed to help with migraine headaches.
That's good.
So
that's good.
Yeah.
Or what I do, I just go to sleep. I get a migraine, I just go to sleep.
Some
Put the
people
cover
can't
over
go.
my head.
It's hard to go to sleep with. I can't go to sleep with a migraine.
There's no way.
I can't.
Look, I turn off all the lights, put the pillow over my. I'm a pro at catching headaches. Right. I got it.
Sounds like you need to see a neurologist.
Yeah. How about that part? Maybe.
Yeah.
So listen. That was amazing.
It was.
So is there let me see. Is there anything that we didn't cover that you're doing? Because you went past everything that we could even ask for. Like amazing interview. What is it anything that you're working on, or is it anything that we didn't touch that you believe that our people should know?
I'll say this, Delaware right next door. Delaware has the highest incidence of Black women being diagnosed with triple negative breast cancer, and they have narrowed it down to certain zip codes. So if you live in certain zip codes, you have a higher chance of getting triple negative breast cancer as a woman. Jeez. So they're trying to look at healthy women or women who have not yet had the diagnosis of breast cancer, and they want to study them to figure out why. And they also think it's because of epigenetics. You're living in an environment that's toxic. You are stressed. You're not getting enough sleep. You're not eating right. You're not doing all the things, and that equation equals triple negative breast cancer. And I say that to say, as we are right next to Delaware, I'm sure there's zip codes in Philadelphia that is the same.
They need to do that. Yeah. Because even when you're stressing, like you said, if your cortisol levels go up, you have a higher rate of getting something, high blood pressure, cholesterol, diabetes. So that's interesting.
Yeah. And then also I'll say April 18th, we have, I'm the president of Byrd Cancer Foundation, and we have our Expo, All Things Cancer and Wellness Expo. Is free to the community. We have free breast exams. It's not a mammogram. It's something called Bexa Equity Alliance. They have a high-powered ultrasound tool where breast density is not a factor, and it just rubs over your breast, and you get the result right then and there. So it's diagnostic. We have Jefferson coming out to doing prostate checks, not the digital rectal exam, but blood. We have Penn doing the cervical HPV checks. We have Advanced Dermatology doing full body skin checks, because Black people always say they can't get skin cancer. That's a fallacy. We have mocktails. We have health wellness vendors. What else do we have? We have oncology dental screenings, because that's very important. When you go to the dentist, they're supposed to feel on your lymph nodes and have your tongue go back and forth. So all this is free. We also have workshops and panels. We have talk about cardio oncology. We have something talking about hair, skin, and nails. Like my braids is by Doso Beauty, and the hair is organic and toxic free. So what you put on your body and in your body is very important. We have a panel about cancer survivors and thrivers and caregivers and co-survivors, which a lot of people don't talk about.
And where is this? When is this? What time is
we gonna be there?
I got my hands I'm like.
It's April 18th, Saturday at the Doubletree Hilton, Center City, Philadelphia, across from the Kimmel Center on Broad Street, 10 a.m. to 5 p.m. free. All the services are free. The entry is free. And the idea is that you come in with an interest about some type of cancer, but you leave with so much knowledge about what you may have or may not have. And yeah.
Jeez.
That's awesome.
Hold on. I just had to do this right. This is a public service announcement, right? Ladies and gentlemen, if you're watching right now, I just want you to do one favor. Like this and share it, because I know someone wants to know this information, because half the stuff I never even heard of before, right? And I know that you could be doing something that's special for someone special in your life that probably don't know, or just someone that just needs to know and just don't have access to the information, right? So if you're watching this and you can hear the sound of my voice, like and share this video for someone to actually know. I am asking you to do this to protect our community, because we love our people, and we're talking about people who look like us. So make sure you share this video. This is probably one of my favorite interviews. I didn't really have to say anything. Yeah, you set it up, right? So why don't you let them know how they can get in contact with you and all that good old information?
Sure. Reach out to me. I'm not going 267-886-5471 is my mobile.
Wow.
You can reach out to me, Byrd Cancer Foundation, BYRD. That's my family's name. Text me if you have any questions, want me to advocate for you. I'm very quick to email somebody and call Channel 6.
Oh, wow.
Yes, she is. Yes, she is.
And I just want to end with make sure you pour into yourself. Like all of you, you're so very busy. Please make sure you get some rest. Please make sure you get some time. Well, see,
What's that?
if you get some time to yourself, even in between breaks, 5 minutes of just quiet or whatever pours into you, because we need our people, and we are dying between the violence, between the health, between all the things, the prison pipeline, all the things. And we need to make sure that we pour into ourselves and create this community where we're checking on each other. So, yeah.
Wow. Wow.
Awesome.
Phenomenal.
Let this be said. ladies and gentlemen, one, I want to thank you for coming to the show.
Thank you.
You know, one things we say is once you come to the show, you're a friend to the show, so you're always welcome to come back. I think you gave some excellent information, some amazing information that people just need to know and hear about. And so I think we'll definitely be inviting you back just to talk about, you know, some of the latest even trends in medicine, or some other details, or some pressing news, or some flash. This is what you need to know, something, right? We definitely will bring
And
you
her
back
books.
Your book. Let's talk a little bit about that, because that's what we didn't do. Right, before we let you leave, because you got some, she said, the children books, right? Yeah, holla at us. Tell us a little bit about that before we let you go.
I made it because of my grandma Smiley. She smiled all the time, even when she was going through cancer treatment. She said if God trusted her with multiple myeloma, she was going to carry it with dignity, excellence, and grace. And so my children's book sort of mimicked her life. She told my brother and I, never look down on anyone unless you're extending a hand down to help them up. So that helped with feeding those who are unhoused. That helped with so many things that we do. So the children's book is about Smiley, and the other one is a letters to myself, to my younger self. And it's a little dark-skinned Black girl looking in the mirror. It's someone who has an amputated leg but playing basketball. It's talking about kindness. It's talking about acceptance. It's talking about all the things that I think is lost in this world, but secretly, and not so secretly, it brings people back to agape love and my love for Jesus Christ. Wow. So I always have to make sure that, and I remember that I'm a servant of him, and anything that I do, I represent him. Sometimes it's probably the West Philly version. So that's what the books are about. That's anything that I do. My nonprofits, the Nia Imani Bailey, I don't even do that whole doctor thing, because because it's like when I enter the gates, he's not going to say, "Well done, doctor." You know what I mean?
But
Like
he
it's not.
pointed you
It's
to a doctor.
But it's not, my
Yes.
great grandmom had a 5th grade education, but she was the smartest person ever. So
She
that,
was a doctor
yeah,
too.
right. You know what I mean?
That's it.
But everything that I do is the basis of agape love, and it's the basis on Jesus Christ.
Awesome.
Yeah, fantastic,
Phenomenal.
fantastic. Well,
Phenomenal.
all right. Well, one more time, how can I get in contact with you real quick? Jeez.
BYRD, Byrd Cancer Foundation, 267-886-5471. I'm a best texter, then call me, but whatever, you can call me too.
Awesome.
And yeah.
There you go. There you go. So if you need an advocate, make sure you slide in her inbox, text her out, let her know that you need her to advocate for you.